This presentation is about the muscle coordination about the shoulder joint during a javelin throw. Some context for javelin throwing. Javelin throwing is an ancient activity, so old we have fossil evidence of it. In a site in Germany, it was discovered that there were two separate fossils that had puncture wounds indicating spear-like puncture. Granted, and this is speculation, that those spear puncture wounds were a result of the spears being thrown. A javelin. Again, javelins are basically just spears, but skinnier and meant for throwing. In terms of the athletic aspect of javelin throwing, it's been a part of the Olympics and a major track and field competition for millennia, quite literally. It's one of the oldest sports in the Olympics. One of the major factors in achieving the furthest distance with the javelin is the release speed of the javelin. You're trying to impart as much energy and force onto that javelin as you can, because once it's out of your hand, it's out of your hand. You cannot add more energy to it, and it needs as much energy to go as far as possible in that one throw. Now, it's important to note that there are multiple phases of a javelin throw. Javelin throwing is not necessarily done from a standing position or in any other position. At least competitively in the Olympics, it has a run-up period to it. You have some room to generate even more speed and momentum before you actually throw. The article I'm citing for this has 4 phases of proper javelin throwing technique. Now, these are important, however, because we're focused primarily on the shoulder, those 3 that are most relevant for our understanding are, as the article describes, the drive, the throw, and the recovery. Movement in the shoulder. Given the nature of the glenohumeral joint, we're going to be able to see a lot of movement. In fact, we'll see it on all 3 planes of movement. We see that flexion and extension in the sagittal plane. We see vertical abduction and vertical adduction in the frontal plane. And we see horizontal abduction and horizontal adduction in the transverse plane. The primary movement we'll be focusing on in this study is the shoulder in horizontal abduction and horizontal adduction, with the focus primarily being on horizontal adduction, as that is the movement in which we impart the most force in the javelin throw. I just wanted to make a quick note. I'm not entirely sure what the non-cardinal plane down here is referring to, as it looks nigh identical to stuff being done in the frontal plane. Muscle activity in the shoulder. So we've established that we're primarily focused on horizontal abduction and adduction, right? Now we need to discuss the muscles that actually do those things. So starting us off with the abduction, so we can get the arm in position, cocked and ready to throw the javelin. So those muscles are primarily responsible for causing horizontal abduction are the infraspinatus, teres minor, and latissimus dorsi. This is aided in part by the supraspinatus and partial activation of the deltoid. More on the deltoid later. Coming to our main focus is the primary muscles involved in horizontal adduction. In this case, it's primarily the subscapularis and the pectoralis major, with pectoralis major being the more important of the two, as it is basically the ultimate horizontal adduction muscle. It's important to note that horizontal adduction is also partially helped by the deltoid. You may have remembered I mentioned the deltoid a second ago. The deltoid is weird as it both helps with abduction and adduction, which makes it basically an agonist to itself in some cases. But as I'll get to later, it's not a primary mover of the arm in this motion. Additional muscles of the shoulder. Now, I would like to stress, these are not true shoulder muscles. They're just effects on it, as they do have insertions to the scapula that does affect the scapular position, thus affecting the glenohumeral joint position. However, for our purposes, none of these muscles actually affect horizontal ab or adduction, but it was important to include them as they do involve themselves into the joint movement and other directions of movement. Phase 1, the approach. While the shoulder rotation is not the primary focus, again referencing back to earlier, we're more focusing on the throwing aspect of it. It's important to mention phase 1 in preparation for the other phases. During this phase, the shoulder mostly stays perpendicular to the sagittal plane, holding the javelin out. Phase 2, the drive. During this phase, the shoulder begins to move. As I've mentioned, it's kind of locked into that kind of perpendicular angle. Now that it's starting to be moved backwards, we're seeing how the infraspinatus and the teres minor are pulling back on the shoulder to horizontally abduct it back. By doing this, it's producing tension in the tendons of the muscles involved in adduction. So when those muscles activate, there's even more force pulling the arm inwards in the adduction motion. Phase 3, the throw. The shoulder ends its abduction and begins horizontal adduction through what Sandler refers to as the power position. Basically, the position that one takes when throwing, regardless if they are starting from a running start or from a standing position. In this motion, the supraspinatus and the pectoralis major use the energy that was stored in their tendons as the arm was being horizontally abducted backwards and launch the javelin forward. Phase 4, the recovery. So at this point, the shoulder ends its horizontal adduction, or at least the muscle activation for it. However, all that force that's been generated into the shoulder and the arm, it's still going. It's still going to go across the body. So during this phase, those muscles that are formerly trying to abduct the shoulder back are now trying to help slow down the shoulder as it continues to adduct. EMG activity of the shoulder muscles. Muscle activations of the infraspinatus, supraspinatus, and the 3 parts of the deltoid indicate that their primary function are that they are joint stabilizers. They keep you from ripping your arm out of its socket. Now, the subscapularis and the pectoralis major are, as the article defines them, major accelerators in horizontal adduction. As you can see in the graphs to the left, there's essentially 100% activation of the pectoralis major and a number of the other muscles involved in a throwing motion. However, as we are focusing on the shoulder, mostly focusing on the pectoralis major. It's important to note that there is a difference between professional javelin throwers and normal individuals, as the professional javelin throwers appear to have muscle activation much closer together than compared to a comparison group. In conclusion, muscle coordination about the glenohumeral joint plays a major role in achieving maximum acceleration and angle of attack when throwing a javelin competitively.